if I understand correctly, that Professor Strassman was one who did the first experiments on humans with these psychedelic drugs after what we would call this frozen time, when due to restrictions in legislation, people haven't been able to experiment with psychedelic drugs with people. And other kind of point which I definitely should mention, that Professor Strassman has wrote a lot of interesting books which are not meant only for professionals, but I would say for general public. One which impressed me personally was a comparison between these altered states gained by chemical drugs and recorded experiences of Old Testament prophets. I think this was something which I think changed my attitude to these altered states of the mind. But today, what we can expect from Professor Strassman is something which is titled, "Why do we seek our altered states of consciousness?" Why, let's say, normal people are looking this kind of states of consciousness. And we do that in meditation, in chemical altered states of consciousness. So people in general are interested in that. So Professor Strassman, floor and screen is yours.
Okay, well, thank you very much. Yeah, it's a pleasure being here virtually as it is. Thank you for the invitation, for your generosity. Looks like I can, well, you know, to address your point, yeah, our study in Albuquerque from 1990 to 1995 was the first new American research with psychedelics in a generation. We studied mostly DMT, dimethyltryptamine, which is the visionary ingredient in ayahuasca, and we also studied psilocybin. And we helped other groups get off the ground, including the Hopkins group with their psilocybin work, which came out maybe 10 or 12 years after we wrapped up ours. Okay, it looks like I can share screen, so let me do that. There we go. Okay, can you see that all right?
It looks that it's coming. Yes, it's there.
Okay, good. Okay, so I was going to address this. I was going to address this topic from a little more of a personal view, personal perspective, which relates to my newest book, which came out in December, which is an autobiographical account of a number of my own altered states between birth and 22 years old. So it's a series of vignettes. It's an illustrated volumes called My Altered States. And as the talk progresses, I will show a picture of the cover. But I think a more general approach to the topic is why people seek or experience altered states, what to make of those experiences, how they come about, what to do with them. So Charles Tart, a psychologist at University of California, Davis, more than 50 years ago, put forward a definition of altered states, which I think still holds true. It still is enduring quite well. It's a qualitative alteration in the overall pattern of mental functioning, such that the experiencer feels his consciousness is radically different from the way it functions ordinarily. So it's more of a qualitative definition, a subjective definition, as it were. In other words, you feel different. Your mind is working differently, functioning differently. One could break it down into alterations of specific mental functions, For example, cognition, emotion, body image, sense of self, those kinds of things. Specific, drugs, may alter specific mental functions. For example, the amphetamines increase thinking processes and increase mood. The sedative hypnotics will, cause relaxation and mental slowing. One of the most interesting aspects of psychedelics, and one of the reasons I was so fascinated by them, is because they alter every component of mental functioning: mood, thinking, perception, body image, and sense of self. So to give some examples of altered states, there are those that come on unbidden, more or less. They just occur physiologically. There's dreaming, there's childbirth, illness, delirium, near-death states, dementia, seizures, among others. Many psychiatric conditions also are accompanied by altered states of consciousness, especially in psychotic conditions like mania, schizophrenia, depression, derealization, depersonalization, panic attacks, anxiety, those kinds of things all are accompanied by an altered state, which might impact one or more components of consciousness. And substance-induced altered states, and there are plenty of substances out there which can induce altered states. There's alcohol, cannabis, the classic psychedelics, including LSD, DMT, psilocybin, and mescaline, all of which have a long history of use. Ergot, which is the precursor, for LSD, was probably used in intoxicating beverages in prehistory and beyond. There's MDMA, which is a synthetic drug. Ketamine, which is synthetic as well. Salvinorin A, which occurs in diviner's mint. There's ibogaine, which kind of borders classic psychedelics and an atypical psychedelic. Then there are technique-induced altered states, such as prayer, exercise, meditation, fasting, sleep deprivation, chanting, drumming, and prolonged hyperventilation. The technique of prolonged hyperventilation is the basis of the Groff holotropic breath work, which has become quite popular over the last several decades. There's the contexts of altered states. Who do they occur in, and in what kind of circumstances? So there are bidden and unbidden altered states. The medical or psychiatric conditions which are accompanied by altered states are unbidden. They come upon you if you like it or not. In the set and setting is crucial. The three legs upon which the tripod of any altered state occurs is the set and the setting, and the stimulus, the dose of the drug, the specific drug, the medical condition, its intensity. But with respect to the person and the environment in which the altered state occurs, the set is the condition of the individual having the altered state, their physical, mental, spiritual state of health and the previous experience, with any particular altered state. So for example, if you're having a first episode of schizophrenia, your response to the hallucinations will be very different than your response to the hallucinations after your fifth or your 10th episode. The setting is the interpersonal environment. Are you with friends or enemies or by yourself? You inside or outside? Is it a psychotherapeutic setting or a spiritual setting? So the physical environment and the interpersonal environment go into the setting. The intention, I guess, would be included within the set, but I think it's important enough to separate out from the set itself. So the intention, if you have one, is quite important, because it will steer the set in the setting, how you prepare yourself, and in what circumstances you will experience the altered state. Most people, at least when it comes to alcohol, drugs, cannabis, usually use substances or enter into these altered states for fun, for hedonistic purposes, to increase their appreciation of aesthetic sensibilities. Some people use altered states for spiritual or religious purposes. For example, prayer, meditation. Psychotherapeutic purposes are the ones which are getting the most attention within the medical setting, which makes sense. But also on your own, lots of people will use psychedelics in particular, and I suppose to a lesser extent cannabis for what's called inner work, learning more about yourself, psychotherapeutic purposes, dealing with conflict or depression or mood problems, anxiety problems, and also quite important are uses in the worried well, so to speak, for wellness. For reasonably healthy people who just want to feel better, and for scientific and artistic individuals who are working on creative endeavors. They might be encountering some kind of block, and would like the changed perspective which altered states can provide sometimes. So this is my new book. Just came out a couple of months. Oh, actually, about 3 months ago now. The middle of December. It's an illustrated memoir, and lots of it deals with early traumatic experiences within my family. So I recount. Stories of experiencing of experiencing trauma, as well as recollections, ways of dealing with it as well. Recollections during altered states themselves, and working on healing, working through those experiences. So. One of the questions I'm asked relatively frequently is why I wrote the book. There are a number of reasons. One is it's a more nuanced approach to altered states. I've spent a lot of time in psychotherapy, a lot of time meditating. So I've been looking at my experiences over the decades, and I think I am able to provide a more thoroughgoing description of various altered states than might be typical. And also I include narratives which involve a number of different substances, alcohol, cannabis, psychedelics in particular. and different conditions, depression, a state of hypomania, meditation, so non-drug states as well. The stories are interesting. I like telling stories, and I think there's 35 or so chapters in the book, and they vary from enlightening and ecstatic to horrifying and kind of purgatorial. So it covers a wide range of possible altered states experiences. And also, at the end of each of the chapters, I have got a section called Reflections, which is a commentary. Like it's an exegetical treatment of each of the experiences. How it came about. Why I think it came about. What I learned from it. By the time that I wrote the book. I was facile or comfortable with a number of different models, and I apply those in understanding the states themselves. Psychoanalytic models, medieval metaphysics, psychopharmacology, Buddhist meditation as well. So each of the chapters is accompanied by reflections on those states, like how am I made or was unable to make sense of them. So the rest of the talk will be personal, like why I wrote the book, why I took these substances, or why certain experiences occurred, and I'll give some examples of substance-induced effects, which I explicate in certain chapters. So my motivations, between 0 and 22 years old, as I mentioned earlier, I was dealing with a relatively traumatic childhood. So by the time I began experiencing altered states in my late teens, early 20s, I was dealing with kind of a low-level PTSD, and there was anxiety as well, and I also grew up in a fairly sheltered environment in Southern California in the 1950s and the 1960s. And my first couple of years of college, it was very difficult to fit in. So I was experiencing a fair amount of social awkwardness. In addition, I enjoyed altered states. They gave me a great amount of pleasure, and I also enjoyed the sensory, the enhancement of sensory experience, visual and musical in particular. There was also a sense of curiosity that was impelling me. I started off college as a chemistry major. I liked making fireworks and making bombs, and I actually started off thinking I would start my own line of fireworks as a chemistry major. So when I first experienced cannabis, for example, and there was this incredibly different state of mind which occurred as a result of ingesting this material. I thought to myself, it's chemistry. So that in a way got me started on my interest in psychopharmacology, the effects of chemicals on the brain. Scientifically, psychologically, I was fascinated by the states as well. Like I was calmer and had insight and could relax, and the inner dialogue finally ended, and I thought, oh, this is very interesting too. Back then anyway, in my late teens and early 20s, spiritual issues weren't really front and center. That only came about later once I began learning about religious models, for understanding and integrating these states. So the first substance which I encountered that provided an altered state was alcohol. I never drank until I went away to college, and the second night of college I got drunk, and I was I'm observing the experience as it developed. So there was relaxation. I felt euphoria early on. I felt, disinhibited, like I was, taking more, risks, than I might otherwise, socially, physically, those kinds of things. I was more socially interactive, but it was, kind of a double-edged sword. Like I was more friendly, but I also wasn't as empathic. So I think there was a slightly aggressive edge to my friendliness, which was an interesting finding. My mood was labile. I was very happy, or I was very sad. Kind of maudlin, or euphoric, garrulous, or quiet and withdrawn. My empathy, as I mentioned, was diminished. I wasn't really caring about other people that much, which I think made me more friendly because I wasn't as responsive to feedback. But at the same time, I was lacking empathy. I just didn't really care about other people. These were all moderate effects. They weren't like florid, but still, I noticed them as acute effects of the alcohol. I did not like how I felt the next day. The first few times I drank way too much and was very hungover, which was a striking finding, which I think overall was quite helpful because both of my parents overdrank, and I think if I had found alcohol more simpatico, I may have ultimately developed alcohol-related problems like both of my parents did. So cannabis, well, the first exposure that I had to cannabis was hashish, and I loved it. It was like a hand in a glove. I was relaxed, I was happy, I was euphoric. I was quite self-absorbed, not in an unempathic way, but just kind of, I wouldn't say catatonic, but bordering on it, just like completely in myself. And one thing which I found most interesting is my inner dialogue, this critical, sarcastic, just nonstop commentary on my experience just was gone. Which allowed me to, to be in the moment, at the very least, and to much more carefully observe things both within my mind and in the room. I had some insights. Psychological insights, perceptual insights about the nature of music. There were purple clouds coming out of my stereo speakers, which was completely unexpected. And my roommate and I, shared a flying carpet hallucination of flying over the town where the college was, and we controlled the movement of this flying carpet together, and we saw things on the ground together. We were going up and down and pointing out things. My short-term memory was pretty much gone. Which in a way puts you in the moment, like meditation. But it's but it isn't meditation, obviously. But still, it was close enough to meditation that it whet my interest in meditation later on. But as a result of being in the moment and the inner dialogue fading away, I was able to pay much more attention to things in the room and in my mind. Let's see. There we go. Yeah. So psychedelics also were extremely, sympathetic with me and, me with them. As I mentioned earlier, they impact every component of consciousness. So it's way more exciting in a way, way more, complex than, simply a stimulant or a more sedative. The perceptual effects were, extremely intriguing. The visual ones in particular, but I also noticed, that the quality of the visions and, the visual effects were, quite responsive to mood and to thinking. Like if I was happy, the colors were happy and bright and cheery. And if I was, feeling down, the colors, took on a more, kind of ominous, quality. I lost awareness of my body a few times early on, just, floating in the ether. Um, labile mood as well, extremely sensitive, to the setting, the interpersonal setting, being alone, being with friends or with, strangers, so it, could vary from euphoria and hilarity to abject, terror and fear. I had, some, flashes of creativity. It was interesting. I was able, to break a couple of habits. And I'm under the influence of LSD. One habit, was I, tried, tickling myself on LSD one day, and I couldn't. And from that moment on, I was no longer ticklish. It was just the strangest thing. I still am not ticklish uh, in any, I'm in any manner. I'm also, I was camping with some friends who, got me to pay attention to and, be nice, uh, uh, you know, uh, um, uh, to a large, beetle, a big black kind of scary looking beetle, which was, scary at first. Uh, but then with my, friend's help, I overcame my fear of this beetle. Even, started liking it, and I petted it, and, felt compassion for it. And I stopped being afraid of large bugs at that point, which, has carried on ever since. One of the interesting, things about, psychedelics is their portentousness, their, feeling of, uh, um, meaningfulness, like, the feeling of, this is really important, this is really meaningful, even if it's old things in your mind, but they, take on a, they take on an entirely new, quality of impactfulness, meaningfulness, truthfulness. Um, I felt increased empathy, but I think it was more, sensitivity, to interpersonal cues, which I suppose is, one of the, components uh, of empathy. You mentioned lability. One episode with LSD in particular was the, the, I suppose, classic occurrence of, fear of permanent insanity, which was, quite horrifying. Thankfully, an old, friend was around, and he, talked me down. But I had, completely lost, my sense of self. I, felt I was insane. And was always, or had always been insane. And it was just, coming, clear to me, even though everybody else knew it all along. It was just this, black, spiraling hole. Yeah, but thankfully I was able to be, talked out of it. One episode in particular, triggered a mixed mood state. Some hypomania, some depression, which actually, lingered, for over a year, and only ended at the monastery, where I ended up in my early 20s. So how do you understand and integrate altered states? Well, back then, I had, friends who were also smoking cannabis, taking psychedelics, so, we had a little support, network, I suppose. We didn't really, call it, that back then. But for support, direction, advice, conversation. Like, what does this mean? Where can we search for answers? Back then there weren't any models that I could really hang my hat on to understand what was going on. I was in California. I'm in college in the early '70s. So the whole field of consciousness studies was emerging. So I immersed myself in that. I learned about Buddhism, but it was only academically. It took a number of years and until I'm actually began Buddhist practice. One of the things which I found useful, and I continue to recommend, is for people to engage with activities that remind you of the best parts of your experiences. So in my case, it was study, being in nature, as well as well as exercise. Later on, I found I could only go so far with my own altered states, and began several courses of psychotherapy. Only later on did religious and spiritual practices and models take an important role. But still those were inspired or kind of catalyzed through the insights and the feelings which first came about through psychedelics. I spent 20 years or so studying Zen, practicing Zen. Then moved into the study of the Hebrew Bible. And as I mentioned above, psychoanalytic treatment. And in the course of studying the Hebrew Bible, I learned about and became comfortable navigating medieval metaphysics, especially the Jewish rendition of Neoplatonic Aristotelianism, to be exact. So I think the religious and spiritual models, like if you're not suffering from mental illness, can be the most useful in integrating and understanding these states. How to think in an aligned manner with the highest good, and how to live accordingly. Okay, good. So let me stop this share. Okay, great.
Thank you. Thank you so much. We know it's very good to listen to academic talks about psychedelics and all this altered state of conscious experiences. But thank you for sharing your personal experience. We can imagine that it's not always easy. It requires some bravery to talk to people who actually are strangers to you. So thank you very much, really indeed. Do we have questions? Yes, please.
Thank you again for sharing your personal experience. You mentioned music and the pink haze coming out of the amplifiers. I was just wondering, do you consider music to be a very important and vital aspect of the psychedelic experience? And if so, what was or is your favorite music to listen to whilst tripping?
Yeah, well, I think that music can steer the psychedelic state. So if you are interested in being steered, then it could be quite useful. I was talking with a psychedelic psychotherapist a while back, and we were talking about the playlists that lots of people use, and you put on the music and you read your book while the person is undergoing their experience, and we both agreed that it was kind of the lazy man's approach to doing psychedelic assisted psychotherapy. You just you turn on the music and it builds up and there's a crescendo and it comes down, and if somebody wants to interact with you, you gently redirect them to putting the headphones back on. So you could use music as an excuse as well, to not allow your mind to go where it might normally go. That being said, I don't listen to that much music when I do psychedelics. Mostly if I'm taking smaller doses, I'll be walking around outside in nature. Larger doses, I'll just lay down and let my mind kind of take me where it wants to go. I suppose as you're coming down and you want something to relax with, you might put on some some ambient or EDM, low level world music, Bach. Yeah, I'm not especially particular. The most pointed examples of using music, to steer, the psychedelic experience would be the ayahuasquero, songs, which are used in ayahuasca ceremonies. The shamans, have developed, songs over thousands of years, which have got specific effects, which may be useful in specific conditions.
Thank you very much.
May I use again my position, thinking in front of you, and ask my question. Once I remember that Steve Jobs said that you cannot plan your life ahead. You cannot decide that I will be doing these experiments, for example, in your case with these substances, and then I will become famous professor of pharmacology. When you can connect, as Steve Jobs said, these points only when you are looking backwards. When you are looking backwards in your life, how you would evaluate all these experiments, all these experiences, how it influenced your personal life, how it influenced your career, and would you repeat it again if it would be possible to turn back and start again?
Yeah, well, one of the chapters in the book, speaks about that. It's the expression, "research is me-search." I think that I chose the academic path that I did because of my own experiences. I found these altered states to be thrilling and intellectually challenging and stimulating. And I just wanted, to know more and experience more. So it was, both an academic pursuit and personal pursuit. I was interested in all kinds of altered states, and I wanted, and I wanted, to know how they worked. In the beginning, anyway, when I kind of switched into that hypomanic state, it had to do, with a manifesto, messianic manifesto, as it were, that altered states with, psychoanalysis and Zen Buddhism, and, psychopharmacology would be a new healing model to make the world a better place. to bring about utopia, basically. And I went to medical school, and obviously, those, kinds of goals didn't mesh well with, being, first year medical student, which I think was, the trigger, for the depression which ensued. But I, kept, those ideas in mind. And I learned Zen, and I learned psychopharmacology, and I underwent, psychoanalysis, so it was a bit, premature. I was, 20 years old when the manifesto came out, and I, needed to wait until I was, 38, before I started giving psychedelics in order to, test, the applicability or, the feasibility of, the manifesto's ideas. If I had, if I could have gone, well, if I could go backward in time, yeah, I'm not sure. The only, thing I ever kind of wonder about, if things would have been, different. So I went to medical school in New York City, but I'm from California, and I couldn't quite decide, would I do my residency in California or stay in New York. So that was a real juncture. Kind of thinking, well, if I stayed in New York, I would have been analyzed earlier, and I may have delayed the psychopharmacology part of my training. But I think ultimately I would have ended up in the same place, like studying the things that I ended up studying.
Thank you. Thank you. We have more questions?
Last question.
Yeah, yes, please.
Hello, Rick. First, huge thank you that you accepted our humble invitation to give a talk at this conference. And remembering our interview a few years ago, I remember that then we talked about maybe psychedelics could help us with understanding of placebo effect. Are there some researches going on, or it's still open question?
Yeah. Well, when we were speaking, it was around, my notion of, psychedelics as, super placebos, because if you look at the literature, both lay and scientific, it seems as if psychedelics will, they will do everything, depending on the set and setting. They'll help depression. They'll make your liberal. They'll make you more liberal. They'll help your marriage. They'll help substance abuse. You will understand consciousness and non-living entities, all kinds of things. So panacea, like there are panaceas. They will heal everything. So panaceas work through placebo, to a large extent. So I think what may be going on is that psychedelics impact or stimulate the placebo response, which occurs unconsciously. I mean, obviously, but still, the placebo response is a real biological response. There's immunological responses, anti-inflammatory, endocrine responses all occur if you're experiencing a placebo response, either positive or negative. So I think, microdosing, could also be a placebo response without the psychological concomitants of a larger dose. And, that may occur through neuroplasticity effects, neurogenesis effects, which also are occurring outside of consciousness. I don't think there's much new research that is addressing that question. One thing which is being addressed more frequently is expectancy effects. in some of these clinical research studies. Like if you're expecting a response, will you have a greater response to psychedelics in people that do not have high expectations or even expectations of getting worse. So that's being looked at more carefully. I think one thing which would be quite easy to do, which from my understanding isn't being done yet, is to do baseline assessments of suggestibility. Because suggestibility relates to hypnotizability. Hypnotizability relates to the placebo panacea effect. If you're in a specific environment, you're given a substance and you're told that this is going to have X, Y, and Z effects. You're in a way being put into a small or a low-level trance. So I think if people were if people were divided in to low hypnotizability versus high hypnotizability, it would be very interesting to see if the responses or the outcome measures differ significantly. But I don't think anybody is doing that kind of assessment at this point.